So now that you have lost weight with Mounjaro, you are experiencing something no one told you. That is about the loose skin. Well, today I am going to tell you what actually happens and what makes your face saggy or makes it look 10 years older if you are on weight loss drugs like on Mounjaro or Ozempic. Hi, I am Dr. Anmol Chugh. I'm a cosmetic and plastic surgeon and a specialist in body contouring with an experience of more than 1,000 plus body contouring surgeries. And today we are going to discuss that why your face looks older now that you have taken Mounjaro for quite some time. So let me tell you a story of a 34-year-old MNC executive who came to us saying that, Doc, now that I have Zoom calls and everything is there, I've lost almost 20-30 kgs in the last 9 months. My weight has plateaued, but one thing I have noticed is that I have that Ozempic face, which I read in one of the newspaper articles. Well, Ozempic face or Mounjaro face is becoming pretty common nowadays. The problem needs to be understood properly. The problem lies in the fact that your facial volume has been reduced. Why? Because whenever Mounjaro or any Ozempic, these are all semaglutides, these are all GLP-1 agonists that we know. They act on depleting the body fat, and sometimes what happens is that your face compartments which have facial fat, they have superficial and the deep fat to support the face. Now when the compartments are depleted of the fat which is required to give you a fresh look or a young look, then it shows as hollowness, especially in the under eye region or the cheek region. You have a sharp jawline but with a saggy skin. So this comes as a most common side effect that we see. Now what can you do? While if you are on Ozempic or Mounjaro like drugs, make sure your protein intake is adequate. Now I would like to keep it 1.5 grams to 2 grams per kg body weight, depending on your physician can prescribe, depending on your health condition. Plus what I've seen that strength training is very important, especially to maintain the muscular mass. Now the problem with these drugs is that in long term, what we are seeing is it is affecting each and every part of the body. And there are some other side effects also other than bloating and everything. So if you are stuck somewhere, then these are the right options. You can choose from any of the options that are available. But if you're experiencing early laxity of the skin, like early looseness, then radiofrequency, HIFU, and all these medications might, and all these technologies might work. In some cases, fillers and threads can help you, but these are not long-term measures. In cases in which you have lost complete elasticity, you might require something known as facelift, which can be a mini facelift or a full facelift, in which we tighten up not only your skin, but deeper down the muscle layer also, so that you can get that fresh, rejuvenated look again. Now, all these things that we are doing is to gain confidence. But confidence is not just about losing. It's all about regaining your self-esteem also. So be very particular whenever you are using these drugs also. You take care of all the other factors and make sure it is properly monitored so that your skin doesn't sag and you don't look older. Thank you so much for watching.